case histories, which I think will be relevant to today's theme. The first case is basically a 60-year-old Chinese gentleman that has been experiencing general fatigue over the last week. He's known with coronary artery disease, with having had 4 stents implanted in his heart. He's a known diabetic as well as a kidney patient. He happens to be a father of a colleague, a father of a family physician, and he's been feeling generally very tired over the last week. He did not want to bother his daughter from a busy work at the practice. Subsequently, the daughter went to visit him, as the wife said that his father was not looking so good. When she saw the father was actually quite short of breath, and she felt rather blue. And subsequently, the father passed out in front of her. She activated the emergency service. The ambulance came. She had to do CPR on the spot in front of the father. She was panicking. She was calling her colleagues to be ready at the emergency room. And CPR was instituted all the way to the emergency room. She subsequently had to intubate the father inside the ambulance service. At that point in time, we were at the National University Hospital. We resuscitated for over an hour, but despite our valiant efforts, he passed on. So this is a case scenario of a person whereby the daughter is a physician. All help, all CPR was subsequently given, but the father presented late. The father was keeping the symptoms to himself for a good period of time. The second case scenario is also a live case, a 55-year-old Chinese gentleman. And this time he was playing badminton at Bishan Stadium, sweating with excessive sweating, more than usual, and he just felt central chest discomfort after playing the game. He's known with hypertension, but he's been told by a GP that he's been having hypertension for the last 3 years. But he felt that with his exercise, he could go denatural and wouldn't require any medication. The stadium had a medical supervisor at the time and just felt that he didn't look too good, activated the ambulance, and he was brought to the restructured hospital. And emergency angioplasty was performed. I saw him, and within 30 minutes he was brought from Bishan to the restructured hospital and found to have 2 vessel blockage. We fixed his artery that caused a heart attack, and within 70 minutes his arteries were opened, his life was saved, and he was discharged on the 4th day of the heart attack. And this is him, and he's now touring in Turkey. So I think to begin with, I think knowledge is very important. Awareness and early recognition is very important, and I believe that all heart attacks have beginnings. We all have our own stories to tell within this group today, but I think basically if we are aware, we can make the difference. So much progress has been made in the management of heart attacks, but I think majority of death, as Peter has brought up, still occurs before they reach the hospital. And to maximize modern day treatment benefits, we need to increase the public awareness of heart attacks, and that's the reason why we're here today. In Singapore, I think 15 people die from cardiovascular disease every single day. In the 2009 survey, cardiovascular disease accounted for 31.6% of all deaths, which translates about 1 in 3 deaths attributed to heart disease and stroke. Globally, coronary artery disease is the #1 cause of death. Hundreds of thousands have survived but are left with a damaged heart. It's also often that within the media that we see these headlines, which whether it's the English or is it the nightly Chinese papers, that some celebrity has just passed on from an acute heart attack. So to begin with, let's talk about the heart. To understand what's a heart attack, first of all, I think it's important that we understand what the functions of the heart is, and I'm going to begin by talking about the heart. The heart's a muscular organ that pumps there's a pump that transfers blood throughout our body all the time. Where is it placed? Some of my patients may ask. It's right in the middle of our heart, of the chest, and it's the size of a fist. The heart itself, I usually describe to my patients, is like a house. There's the structure of the house, there's the water supply of the house, which is usually the coronary arteries, as well as the electrical system, which I will talk a little bit about. But why is it important? So I think the water supply, basically there are three water pipes in our system, 2 on the left and 1 on the right. So these are 3 water supplies the heart. Then there is also the electrical system that that we have for the regular beating of the heart itself. And in a way, the two systems are interrelated. When someone has a heart attack itself, what happens is the artery gets blocked, there's insufficiency of the blood supply to the heart, and inevitably that can affect the electrical system of the heart as well. So when the blood supply, when you get a heart attack itself, when the blood supply is compromised, the electrical system can go haywire, and in so doing it creates a bad tempo of the heart, and sometimes we actually need to what we call cardiovert them by shocking them, and that's what we watch on the movies. So in this diagram itself, you can see that the artery, when you have a heart attack, there are different parts of the body that actually have various degrees of blockages. And when an acute event happens, a blood clot forms, creating 100% occlusion, resulting in blockage and blood supply being compromised to the area of the heart, resulting in a scar. So, sometimes in itself, you can see that some of the blockages have partial blockages, and that's when there are these symptoms whereby the supply and demand of the equation is compromised. That means the supply of the heart doesn't meet the demand. People tend to walk, they get pain, or they run, they stress themselves, they get pain, and that's called angina. So in this case example up here, in this diagram on the far right, this is actually a post-mortem picture of a patient, of a cross-section of an artery, where you can see that there's a clot that's not completely occlusive, but just partially occlusive itself. And when the demand goes up, you can understand that the blood supply is insufficient, causing symptoms called angina, chest pain. So what actually happens during a heart attack is that essentially there's a rupture of these plaques, whereby the membrane is broken, and subsequently it's an inflammatory process creating a huge cascade of inflammatory cells leading to a major blood clot. So that's where the plaque ruptures, and these plaque ruptures can occur anywhere in the body. If it happens to the heart, that's where we get a heart attack, and if this plaque ruptures in the brain, you get a stroke, and if it goes to the kidneys, you get a kidney impairment resulting in kidney failure, and subsequently you get blocked in the arteries of the lower legs, and that's where you get compromise of the blood flow to the legs, leading to a embolic event. Now, when we have a heart attack, you have a complete occlusion, whereby you can see that on the far right again, another post-mortem picture of the dead man, whereby you can see that there's 100% occlusion, the blood clot occluding itself, and on the left, you can see that this is because of the occlusion of the artery itself. You can see that a scar is formed. That means the muscles die. The two parts of our bodies, for example, the brain as well as our heart, these are cells that once they are irreparable, once they are compromised, they pass on, it doesn't reproduce upon itself. That's why the importance of salvaging the muscles as much as we can. So when the arteries are blocked, you can see that where the area where the heart attack itself, where there's a blockage in the middle part of the artery, you can actually see this is how in a pictorial fashion, just understand what the scar looks like on the heart. And when that area is down, the function of the heart is compromised, and eventually you find that some people, when the function is compromised, they cannot pump blood, and water gets into the lungs, getting shortness of breath. And that's when basically they come in presenting with heart failure. This is probably a very important slide for all of us to pause and think. It's very often in the public that we always ask ourselves that you've just seen your friendly neighborhood cardiologist, what's the degree of your blockage against mine? It's important because in this sense, I think it's important for us to understand that whether the blockage is minor or major, they all can lead to a heart attack. In these science investigations itself, you can see that the majority of these trials, the question is always asked, what is the degree of the blockage before the major heart attack? And you can see that when in this color block, in these color bars, the one in the light blue, which constitute about 70% of these blockages, majority of them are minor plaques, less than 50%, which means that people like myself, even though I may be a cardiologist and you guys are listeners, I can be as prone to a heart attack as you are. Alright, so it doesn't mean that if I need to have a 90% block before I get a heart attack or versus someone with a minor plaque. And that's the reason why medical therapy and preventive therapy is very important. On the picture here, this is a picture of what an acute heart attack looks like. On the right, you can see a 100% occlusion. You can see 100% occlusion of the blood supply. And when Dr. Charles Chang will be talking later, and it's important for you to understand what this procedure is all about, where we can actually revascularize the arteries and create blood flow itself. It's something very important because a lot of times we're talking about time to delay. We may be rushing to patients to the emergency room, doctors can be rushing and dropping everything to the emergency room. But what is halted is that when the general public comes to the emergency room, they say they don't understand what procedure you're talking about, and they want to wait for the daughter to come from Melbourne, which is coming in 2 days' time. Alright, so this is something which I think is important. It's often well spent that we understand what these are about when your friends or your neighbors actually have such a procedure, because time is muscle. It's not as cardiologists, we are impatient men who want results, but it's important for us to understand so that we can help our general public. So you can see in this picture that this is what we canalize, and in this picture itself, this is what is extracted, the blood clot that caused that heart attack. In the next lecture, when Dr. Charles Chan is going to talk about it, you're going to hear a bit more, but I just wanted to give you a pictorial impression of what's going on. There are certain risks. Some of us are more predisposed to getting heart diseases compared to others. There are some that we define as risk factors, and these risk factors can be divided into those that are controllable versus uncontrollable. What are the uncontrollable ones? This is God's gift. Age. As we grow older, we are more predisposed to getting our arteries clogged. We are more predisposed to getting heart attacks. Family history. Some of us bear certain genes that predispose to certain disease states. Race. I think men are more predisposed to getting coronary artery disease compared to women. Until 10 years later, after the post-menopausal period, we are all equal beings. What about control risk factors? I think smoking, we all know. High blood pressure, high cholesterol, diabetes, lifestyle, and stress. People with bad-tempered, type A personalities, they are more prone to ruptures in itself. As doctors, as friends, what do we ask and what do we look for? First of all, we usually like to ask, do you have any chest discomfort? Is it tightness? Is it pressure? Is it pain in the center of your chest? Is the discomfort also in your arms, your jaws, your neck, your throat, or your back? Are you sick to the stomach? Is the patient sweaty or clammy? What were you doing when the symptoms began? Do the symptoms go away with rest? Are you having any shortness of breath? The heart's like a pump, it's like a car. Usually for chest pain itself, it classically is associated with exertion, where the supply and demand it doesn't meet. But for severe cases, you can even get chest pain at rest.